The last major category of the chronic interstitial lung diseases is the smoking-related one. So, in addition to the obstructive lung diseases, smoking is also associated with restrictive or interstitial lung diseases. Smoking-related interstitial diseases include desquamative interstitial pneumonia and respiratory bronchiolitis. The most striking histologic feature of desquamative interstitial pneumonia is the accumulation of large numbers of macrophages containing dusty brown pigment in the air spaces. These pigmented macrophages are called smoker's macrophages. The alveolar septa are thickened by sparse lymphocytes and sometimes fibrosis. The interstitial fibrosis related to desquamative interstitial pneumonia when present is considered mild. The gray arrows in this figure points to the collections of smokers' macrophages or pigmented macrophages within the alveolar spaces. The blue arrows points to mildly expanded alveolar septa by lymphocytes and mild fibrosis. Regarding the outcome, overall, patients with desquamative interstitial pneumonia have a good prognosis and an excellent response to steroids and smoking cessation. However, some patients progress despite therapy. Respiratory bronchiolitis is a common lesion found in smokers. It's characterized by the presence of pigmented intraluminal macrophages like those seen in desquamative interstitial pneumonia. Remember, in desquamative interstitial pneumonia, there were collections of pigmented macrophages within the alveolar spaces. So, what's the difference now? The distribution is different because here they are present in a bronchiolocentric distribution. What does that mean? This means that the pigmented macrophages are present within the lumens of first and second order respiratory bronchioles instead of being within the alveolar spaces like what we see in desquamative interstitial pneumonia. Mild peribronchiolar fibrosis can be also seen in those cases. Clinically, patients with desquamative interstitial pneumonia or respiratory bronchiolitis present with a gradual onset of dyspnea and a dry cough. The symptoms recede with smoking cessation.